Hello, today we're looking at the expiring ACA tax credits and how this impacts stakeholders and the healthcare system as a whole. But first, let's start with some quick context. The ACA created affordable healthcare insurance for millions of Americans through tax credits. These credits were extended in 2021 through the end of 2025, but Congress failed to renew them and the credits have now lapsed. The question is, what does this mean for the healthcare system? We're going to try and answer that. So, from a risk management standpoint, this sets off a chain reaction. Premiums go up, people drop coverage, and that worsens the risk pool, which is your adverse selection spiral. Insurers tighten underwriting, and the government shifts costs to the private sector. And the whole system takes on more operational and systemic risk. And the root of it all is a legal hazard, Congress choosing not to act.
So now we are going to look at the consequences of not extending the expanded premium tax credits. So there are five major consequences that'll come from not extending these premium tax credits. First, we'll have 7.3 million Americans losing their Affordable Care Act coverage. Now, this could lead to this sort of trickle-down effect where if they lose their Affordable Care Act coverage, then most of them could become uninsured, which could lead to a lot of more issues down the road. Second, there would be reduced funding for healthcare and a 47 a 40.7 billion in state economic losses. Now, this is important because this loss to state economies would be 31% greater than the amount the federal government would save from not providing the enhanced tax credits. Third, as this federal funding decreases, this is going to lead and kind of as a sort of domino effect, if you will, this will lead to decreased funding for healthcare providers, related business income, and consumer purchases and state and local revenues. Fourth, there will be a decrease of marketplace enrollment by 7.3 million and an increase of uninsured people in the United States by 4.8 million. Now, this is going to be a big issue specifically in the marketplace because, as we can see in the graph on the right side, this shows that there will be a large loss in coverages because of the enhanced premium tax credits not being extended. And this will be shown as 7.7 million people or 29% decrease in coverage. Also, people who would qualify for zero or very low premiums will find it much more unaffordable and may be more likely to be to remain uninsured. And lastly, because of this increase in healthcare premiums, this will lead to a lot of uncertainty with Americans. This will cause more Americans to feel that they can't afford healthcare. More will be skipping or postponing treatment. Less will be filling prescriptions. And overall, there will be an increased healthcare debt crisis that comes from this. So now that you have learned the consequences from not extending the expanded premium tax credits, who are the main stakeholders and what are the impacts on them from these consequences?
To begin our stakeholder analysis, we can look at the insured, who serve as the primary bearers of personal risk. The expiration of expanded credits creates a significant economic barrier to entry for the healthcare market. Let's look at the socio-behavioral impact. From this behavioral perspective, as premiums increase, we observe a rise in subjective risk. People start to fear they can't afford to stay covered anymore. This fear regarding affordability drives a shift toward active retention. Individuals are forced to opt out of the insurance pool and retain the full financial burden of a potential medical loss. This leads to dangerous behaviors, for example, skipping prescriptions or even delaying life-saving care. The data supports this transition since the numbers for 2026 are staggering. As mentioned previously, we expect about 7.3 million people to lose their ACA coverage, leading to a 20.6% spike in the total uninsured population in the US. This departure of low risk, or in other words, healthy individuals, triggers adverse selection, leaving a disproportionately ill population in the marketplace. The healthy people leave because of the cost, while only those with chronic conditions struggle to stay in the pool. Consequently, this increases the objective risk for everyone left in the market, creating a cycle of rising costs and diminishing coverage. Now, we will analyze how the insurers are impacted. Moving on to the private insurance sector, these firms function as the managers of non-diversifiable risk. Their stability relies heavily on the law of large numbers to predict loss accurately and set a price on it, which then keeps the market stable. The primary threat here is the heightened financial risk stemming from the uncertainty of loss caused by adverse changes in premium income value and the market. Insurers are navigating the uncertainty of how these subsidy changes will devalue their premium income. As the healthy population exits the market, driven by the subjective risk that we just previously discussed, the insurers face an unsustainable concentration of high-risk members. In response, firms utilize risk transfer strategies, passing the increased cost of claims directly to the policyholders via higher premiums. In more extreme cases or volatile geographic regions, we may even see avoidance strategies, where insurers choose to withdraw from specific markets entirely. Ultimately, to stabilize these worsening risk pools, insurers must engage in rigorous enterprise risk management. This includes implementing stricter underwriting standards and utilizing aggressive marketing to try to recapture a healthier, more balanced demographic. Now we will look at how healthcare providers are impacted.
Next, I'll get into how this affects healthcare providers. So, they face two main risks when these premium tax credits expire: commercial risk and operational risk. So, as this insured pool shrinks, providers find themselves treating patients who simply can't pay, and this creates a direct loss. Also, anticipating this, hospitals don't just absorb the cost, but they respond behaviorally in a defensive way. And this is shown through stricter admission policies and less high cost services, meaning the care that they provide is worse. Um, and then on the strategy side, we have loss reduction and diversification, and these limit the exposure to broader financial risks. And something to note is that this $40.7 billion drop in economic activity doesn't just affect the hospital, but it affects staff wages, consumer spending, and local tax revenue. And this is the multiplier effect. Arguably, the most important thing to address is government's role, because they are not only affected by the risk, but they also created it. So, by not extending the Inflation Reduction Act provisions, Congress created a legal hazard that raised the severity of loss for all of the other stakeholders that we've discussed. And these policymakers faced a tension between the systemic risk of a collapsing insurance market and the strategic risk of cutting federal spending. And this choice became a whole risk management decision of its own. So the way they addressed it is through a non-insurance transfer, and this moves the burden from the public onto private households and employers. The fallout is clear from this in an enterprise risk management standpoint, because adverse selection is kicking in when healthy individuals are no longer being covered, and we have a sicker pool, meaning they rely on it more. And congressional inaction itself is objective risk, where measurable uncertainty starts amplifying loss severity for all of our stakeholders.
To summarize our presentation, we first took a look at the triggered risk shift, in which about 7.3 million people lose their coverage, federal funding declines, the premiums rise, and the uninsured population grows. In which our second subject covered the behavioral response, in which the small premium increases leads to coverage drop-offs, and our healthier individuals exit the program, which means adverse selection. Not only this, but insurers raise premiums and the providers cut services. And this would lead to our stakeholder risk responses, in which the consumers drop coverage, the insurers transfer risk via higher premiums, the providers reduce losses, and the government shifts costs. These three all lead up to the system level concern, in which the interaction of these responses increases the financial risk, operational risk, legal hazard, and systemic risk, all of which leads to potential market instability.